Hello viewers, good afternoon. This is Dr. Peter Nuwagira of Pecos Pharmacy here in Barara, and a pharmacist and lecturer at the University of Barara University. I want to take this opportunity once again to thank ETV for caring about our people enough to keep sensitizing them about the things that are happening around them. So today we want to continue from the discussion we had last week. Today we want to talk about herbal medicine and public health. Last time we talked about safety, how we can ensure safety of herbal medicines, how we can ensure rational drug use with herbal medicine, okay, for some of us who actually take herbal medicine. Just to remind us about important statistics with the herbal medicine and public health. You know that the majority of our population here in Uganda, more than 80%, use herbal medicine as their first intervention, okay, for their health problems. So more than 80% tells you that we cannot stop talking about herbal medicine because majority of us are using it, okay, the young, the old, the educated, the urban, the rural people. So it is of important interest to us. Secondly, we also know that herbal medicine is part of what we call complementary and alternative medicine. That means that it can as well be used alongside, you know, our conventional drugs or our Western medicine. So that tells you that it contributes a lot both in prevention and also treatment. Though we know that public health is largely concerned with prevention, but you can also prevent by treatment. You can prevent a complication of a drug, of a disease, by treating it. So today we want to look at public health and herbal medicine. Currently, the statistics in Uganda is that the ratio, the doctor-patient ratio, is 1 doctor per 20,000 for Western trained doctors, our allopathic medicine trained doctors. Whereas for the traditional herbal practitioner, you have 1 practitioner, you know, treating at least 200. So a ratio of 1 to 200 and 1 to 20,000. You see that herbal practitioners are highly accessible. They are so available with. So that is why we have to keep talking about how to optimize herbal medicine, how to use it best, how to rationally use it, how to put it to good use, what kind of measures should we put in place, okay, for us to enjoy herbal medicine and use it appropriately. Why? Because it is highly used, and the practitioners, the people that actually provide herbal medicine services, are quite many. Also to remind you, of course, that the reason many people are using herbal medicine is, 1, because it is culturally familiar. It is something that we are used to, okay. Our parents used them, our ancestors used them, okay, and I mean the plants are available in the fields. Secondly, it is that they are accessible. It is very accessible, okay. It's very, very accessible and affordable. Most of the herbal medicines are not as expensive, okay, except recently we realized that there are so many expensive herbal medicines, especially when they are treating complicated illnesses, okay. They give you concoctions that cost between jerrycans of concoctions that cost between millions of money. So, but largely, most of the herbal medicines that we use are very affordable. So it is affordable, it's accessible, it is culturally familiar. And like we said last time, it has a bit of manageable side effects. Okay, most of the side effects are not far-reaching because we are dealing with natural medicines. Where does public health intersect with herbal medicine? One, we know that most of our population is using herbal medicine. I doubt there are not many people who have not had their babies put in a herbal bath or a shabako. They use it a lot, more than 95 or 98%, so that is public health. People know how to go pick herbs and try to do herbal bath to improve the skin and also to protect the child from adverse environmental conditions, harsh conditions to this young baby, and also diseases. Trying to prevent diseases. So that's one. Herbal medicine also is highly used for those who are having chronic illnesses. Many times when you get diabetes and hypertension, many people fear, because our Western medicine, when we diagnose you with hypertension and diabetes, we put you on medication which is usually for life. So it is supposed to prevent complication, it is supposed to manage the disease. It's also supposed to keep you healthy. So many people fear that long-term treatment with drugs. So a number of them have gone into using herbal medicine. Some use it alongside, some actually have failed to adhere with Western drugs and have ended up into herbal medicine alone, which is of course not a good thing. When you are diagnosed with a condition and given treatment, you're supposed to follow, to adhere and comply with the doctor's prescription. But we know that in practice, many of our patients are actually using herbal medicines. It's one of those areas that herbal medicine intersects with public health. Then the elderly, the old people, because some of them, will get atypical conditions, non-specific conditions. They end up, using their herbs because they are easier to pick. The other thing, of course, is that we use herbal medicine for cosmetics and skincare conditions. There is actually a big market growing now in our country. There is a big market growing in our country of skincare products using herbal drugs and natural medicines. It's growing. It's actually more. In the next maybe 5 years, there will be more. We will import less of cosmetics, and we'll be using more of herbal and natural products. Why? Because skincare is an everyday thing. It's an everyday thing. So many people fear. We are in a developing world. It's a poor society. So many people cannot afford to spend thousands of shillings on cosmetics. So they end up using the herbal cosmetics, which are largely affordable. Public health also intersects with herbal medicine when we are dealing with cancers. We know that most cancers have refused to respond to some of the chemotherapy treatments that we give and all the other treatments. Many help, but some have failed, and so because of because of that, patients have gone into using herbal medicines. Okay, so why? Because most cancers seem to be untreatable. So it's one of the big growing markets for herbal medicine. Cancers, and I mean, we know that they are increasing. The other areas where herbal medicine are largely used in usual cough and flus, because these are usually not complicated illnesses for which patients do not run to the pharmacies or doctors for consultation. So they look at the herbs as highly accessible, and I mean, they use them. So because of that background, that is why we are interested in public health being a cornerstone, or a place where herbal medicine is highly prevalent. Okay, we know that the World Health Organization strategy on traditional medicines has 4 strategies. Okay, the World Health Organization traditional medicines strategy, it focuses on 4 areas. One area is policy. Okay, so these 4 things, they are impacting the use of herbal medicine in public health. So one is policy. The other one is safety, efficacy, and quality. The other one is access. Okay, and then we have rational drug use, which we tackled very well last time. So all countries, all societies, for them to improve their public health use of drugs, and in this case herbal medicine, they have to look at those 4 areas. Okay, policy and regulation, that is the first area. Here we are talking about how can we give official recognition to herbalists and herbal practitioners. How can we recognize their associations that bring them in, those umbrella associations? How can we mainstream them into the public healthcare system? Okay, so those are things that herbal practitioners, herbal educators, like us, community pharmacy owners that handle herbal medicine in their shelves, in their stocks, the doctors of the complementary and alternative medicine doctors, the manufacturers of herbal medicine. So those are crucial areas that people should look out for. Okay, so that is one. Policy and regulation. Safety, efficacy, and quality. So there we are looking at evidence base for herbal drugs. Okay, what evidence is there that Covidex treats COVID? Okay, so what basis is there for that Elocough actually treats cough? Okay, and many other products. I'm just giving examples. So there, governments and us, even the patients, the consumer association should be concerned. They should be concerned of what evidence should be there. That is why National Drug Authority is pushing the manufacturers, go do clinical trials. Do not just test the herb in the lab and then put it on the market. Let it go through some trial processes, okay, so that we build that evidence base. Secondly, of course, standards, putting international and national standards for safety, efficacy. Okay, I'm happy that currently in Uganda efforts are being done. They are being put together to come up with a herbal formulary. Okay, a herbal compendia that is where different herbal formula, or drugs and their formula are put together so that we know what Elocov contains. Okay. So also on safety, efficacy, and quality, we are talking about adequate regulation of herbal medicines. If they are adequately regulated, I mean, if we know that the process to have a herbal drug on the market, this is the process that it takes, so that people are aware when they are starting to, before they start to manufacture, they know what they will go through. Some of this information, yes, has been put out there, but most of it is lacking. Most of it is lacking. That is why you have many quack herbalists, practitioners. They are marketing drugs, yet they do not have the entire data about the drugs. So this should be encouraged. Okay, regulation of herbal medicine, appropriate regulation. Maybe it may not be regulated the way they regulate the other drugs, but at least regulation helps to protect the public from quack medicines, quack herbalists. Then we are talking about registration of traditional and complementary, medicine practitioners. Okay, umbrella associations, the government, and the different stakeholders should encourage some of us who use the herbal medicines. Okay, when we have any complaints, where do we go? Okay, where do we go? Or when we have important information that you want to put across, so those forums should be put and harnessed such that people use herbal medicine and use it appropriately. Okay, research support. Many students in pharmacy school, they are doing good research in herbal medicine, but the funding is very limited. Okay, so most of them get they get disappointed and they go into other things. Okay, into business, other areas of practice, and yet if they kept in herbal medicine, they would improve its plight and make it useful for all of us. Okay, so that is the second area where public health and herbal medicine should be looked into. One was policy and regulation. This is safety, efficacy, and quality. The third one is access. So I don't know, for example, if we even as researchers, if even as academicians, you don't have ongoing statistics of how many people, okay, are using herbal medicine, or how many people are using certain areas of herbal medicine, or what patient populations are using herbal medicine more than the other patient populations. So we lack data measuring access levels, okay, and affordability of herbal medicine. So that should be improved. The other is, of course, official recognition role of what I've already talked about, herbalists and the herbal associations. There should be some level of recognition such that their efforts are improved, and where there are gaps, they are also worked on. Okay, then we have acceptability of herbal medicine to be picked, to be gotten from these mainstream pharmacies. For example, currently there are so many restrictions for those corporate clients that use insurance. Okay, you find all the other drugs are on insurance, but herbal medicines are excluded. Okay, so that does not expand access. It doesn't expand access of herbal medicine use, and yet we know that when put to good use, it is actually very helpful. Okay, we need to identify safe and effective practices. Okay, safe and effective practices. I mean, things like training. These herbalists should also have some bit of certification. Okay, say that we know where to go when we want a cancer drug, a cancer herbal, formula. We know where to go when we are dealing with, COVID cases, when we are dealing with malaria, when we are dealing with. So it's important for us to think about areas that can improve access of herbal medicine, because that helps public health. It makes herbal medicine more acceptable and rationally used in public health. Then there is lack of coordination between the herbal practitioners and the trained practitioners. So you find that the healthcare system, it divides, it makes a clear demarcation between Western medicine and herbal medicine, and yet I believe that these should be complementary. It should be very complementary. Both should work hand in hand. Okay, to the extent that we should develop our systems to the level where I come to the hospital, you diagnose me with malaria, and I can choose whether to go to a herbal practitioner, recognized, trained, and herbal practitioner. I can go there, or I can choose to go to a Western trained doctor. Okay, that is where we should go. That is the point where we should reach, such that it is actually complementary. This herbal practice is complementary to Western medicine practice. Okay. Then conservation. Okay, conservation, sustainable use of some medicine species. How do we conserve them to make sure that treatment using those herbs is going to be sustainable in the near future? There is research that has been published about Mlondo. Mlondo is a herb used to give it's a libido enhancer to men. So what the new research is that it is being extinct. People are using it, they are using it unscrupulously. Okay, so there is no one to cultivate it enough for the market. At Messianua, at a certain point, we could not get enough, at Messianua, herbs to use for the production of the antimalarial. So we need efforts that can conserve herbal drugs, so that they are always going to be available for public health. Okay, and then there is lack of recognition of the providers. That one I've already said. So that is the third area of interest. The first being policy and regulation, the second being safety, efficacy, and quality, the third being access, how to improve access of herbal medicine into our public health space. The fourth is rational use. Okay, we talked about it last time, but I can remind us. One is that we lack training standards for traditional herbal practitioners, and even for the different herbalists. Okay, so we need those training. We need to set standards, okay, of who can practice. Okay, it may not be the same standards we use for the Western medicine, but at least with concerted effort between the practitioners, the policy makers, the regulators, and the patients, the clients, standards should be put in place to make sure that is possible. Okay, the other one is lack of traditional and complementary medicine training for allopathic practitioners. For us, it's not enough. If I know that my patient, when he comes to take bisoprolol for his hypertension, if I know that this patient is taking other herbal, medicines, I should be interested which ones they are. I should know which ones are registered with NDA, so that I can know how to taper my dosage for this drug, because he's also using this, okay? And or to say maybe you stop this and first use this. That information must come out by training, by sensitizing the medical practitioners and my colleagues, to know that herbal medicine can as well have a big impact. So how do we bring it into our practice? We also need to know, just like those herbal practitioners also need to know, that the same patients that they are treating with herbal medicine are taking other drugs. So I think that training must come out very well. Then lack of communication between the herbal practitioners and the Western medicine practitioners. Okay, exactly what I've just been talking. We need that communication. We need to know what is happening in each of those, because our whole goal in practice is to improve the health of this patient. Okay, is to have an improved quality of life for this patient. So if this patient is a patient that is likely to use both my drugs and the herbal medicines, then it's a discussion that we must make. Then there is also a lack of information for the public on rational use of herbal medicine. So that's why I call upon the public to keep using these resources like AETV, using these points of interaction to educate themselves how far herbal medicine has come, or how good it is, and or how it can be improved upon, how it can be rationally used. Okay, that discussion must come out, and I want to encourage us. I want to encourage the public. Okay, let's read. I've been told that there's now a new act. There's a traditional and complementary medicine act, okay, Uganda of 2019, okay, and that it puts in place so many things. It tells you who should practice herbal medicine. It tells you how should it be practiced. It tells you the processes for its registration. It tells you how you can improve rational drug use with herbal medicine. So with that, the public will be sensitized and use drugs better. My interest as Dr. Peter, my interest as a health practitioner, my interest as a researcher and academician, is to see that the patient who is benefiting from these drugs gets the best deal, okay, out of our drugs. So if it is herbal medicine, he needs to have them safe, okay, and efficacious. Okay, there should be evidence that they work, and indeed they should be protected. Their safety should be protected. Okay, and all the things that we need to think about before we take drugs. So with that, I want to thank AETV. I want to thank our viewers for always putting in their time, okay, for such educational programs. I pray that this will add value to you as a patient, as a practitioner, as a stakeholder in public health and in herbal medicine practice. Thank you so much, and God bless you. Hello viewers, good afternoon. This is Dr. Peter Nuwagira of